Hey guys, Justin Thompson, physical therapist, and I'm coming to you guys today to show you one of the methods that I use for treating low back pain, especially that is for spinal instability. So somebody comes in and they have a lot of discomfort whenever they're moving, especially into spinal flexion, if they have a herniated disc or something like that. One thing that I do is I want to work on the stability around the spine, and one of the best ways to do that is a kind of a classic grouping of 3 different exercises called the McGill Big 3. And it's named after a physical therapist by the name of Stuart McGill, and he was the one that kind of popularized these 3 exercises as 3 of the best ones for spinal stability. So I'm going to go ahead and show you those 3 right now. Move with Freedom PT is a name owned and controlled by Thompson Physical Therapy, PLLC. Not all exercise or health information is suitable for everyone. The information provided is for educational and informational purposes only. No information is to be taken as medical or other health advice pertaining to any individual's specific health or medical condition. The information should not replace the professional diagnosis and treatment needed from a qualified healthcare provider. So the first one I want to show you is the curl up. And it's not exactly like a sit-up or a crunch, but it looks kind of similar. So I want to show you how it's different though. So what you're going to do is you're going to lay one leg down flat and put one knee up in the air. You're going to take one hand and put it underneath your lower back. Now the reason that's there is you don't want to have a lot of spinal flexion whenever you're doing this curl up. You want your spine to stay stable, okay? So whenever you're in this position, you have your hand underneath your lower back to kind of help to stabilize, or at least to cue you to keep your spine in a stable position. Now, what the movement is you actually want to lift your head and shoulders up off of the ground, kind of engaging these anterior trunk muscles here, while trying to keep the normal curvature in your lower back, okay? So if your hand is under your back here, then you're trying to lift your head and your shoulders straight up off the floor, right there, trying to keep that curve in your lower back, but you can still feel these muscles on the front side of your abdomen kicking into gear, okay? So you'll lift up, you'll hold for a count of 5 seconds, and do that 10 times. The second exercise in the McGill Big 3 is the side plank, okay? So you're going to go onto your side with your elbow directly underneath your shoulder, and you're going to take your top leg, you're going to put it in front, your bottom leg, you're going to put it in back here, and then you are going to lift your entire body up into this position right here. So it engages the side, or the oblique side, of your core. So it's kind of working, if the first one engaged the front, this one engages the side, and then you hold this for a count of 10 seconds, and you're going to do that 10 times on each side. The last exercise in the McGill Big 3 is the bird dog exercise. So what this looks like is you're going to go onto all fours here. Alright, your hands are going to be directly beneath your shoulders, your knees directly beneath your hips. Alright, so knees are about shoulder width apart. And what you're going to do is you're going to try and find a spinal neutral position. So you're going to drop your spine down to find the extreme of extension, and then you're going to bring it up to find the extreme of flexion. And then you're going to find the in-between, okay? That in-between is your spinal neutral position where everything is maintaining a good solid position here in your spine. Alright? So once you're here, what you're going to do is you're going to take one leg and the opposite arm, and you're going to extend them out away from you, keeping your spine and your trunk stable. So you should not get any flexion or extension in the spine whenever you do this. You should be kicking straight out behind you and straight out in front of you with your hand. Just like this. Spine, low back, core should all stay pretty strong and stable. You're going to hold this for a count of 5 seconds, bring it in, kick it back out. Okay? Again, keeping that spine neutral even as you bring this in and out. Just like this, you're keeping all that stable, and you're going to do that for a count of 10. So 10-second holds, 10 times on each side. So that's the McGill Big 3. It's really, really good for helping people to get out of that acute low back pain stage. So I hope you guys like this, and I hope that you would subscribe to the channel. Go ahead and do that now, and we'll see you next time. And as always, move with freedom.